Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my husband suffered a heart attack, has been in an induced coma for over 3 weeks now and is not waking up. What do I do? Help. You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers. And the question this week is: my son's father had a heart attack and is not waking up in intensive care after cooling therapy. Please help. This question from Karen formed part of an email consulting and counselling session with me. So, Karen writes: Hi Patrick, my son's father had a previous heart attack last year. He had a second heart attack 3 days ago, and we were told he lost oxygen to the brain during the heart attack. When the ambulance arrived, they also had to defibrillate him. He was in a cooling therapy in intensive care for 2 days, and they are now trying to wake him up from the induced coma, and they're now trying to wean him off the ventilator. We are wondering what the expected time frame is for him to come out of the induced coma, wake up and get off the ventilator. So far my son's father shows little signs of waking up, and we are worried that he may have some irreversible brain damage. Also, my son and I are not allowed to get any information from the intensive care team about my son's father's condition because we are not the next of kin or power of attorney. Can you shed some light on this issue, please? Much appreciated, Karen. So, here is my response. Hi Karen, thank you for your question, and thank you for signing up for email consulting and counseling with me. I can only imagine how stressful this must be for you and your son, not getting enough information about your son's father's condition. Given that your son's father had 2 heart attacks within less than 12 months, and given that on his last heart attack 3 days ago he had to be defibrillated, things look pretty difficult from my perspective from the information that you've shared. It's likely that the heart attack has caused some irregular heart rhythms like VT, which stands for ventricular tachycardia, or VF, which stands for ventricular fibrillation, that cause the heart to basically stop working and produce a meaningful blood pressure. Therefore, the defibrillation is necessary. The heart attack therefore must have caused a cardiac arrest, which is actually much worse than a heart attack. If the heart needs defibrillation, there is always a chance that the heart couldn't maintain a meaningful blood pressure, and therefore hypoxia, or lack of oxygen to the brain, is a real possibility. This is because the heart couldn't supply the brain with enough oxygenated blood during the cardiac arrest. You also mention in your email that this might have been a possibility, and you are voicing concern that your son's father may have experienced a lack of oxygen to the brain. Quite frankly, if there was insufficient oxygen supply to the brain for more than 3 minutes, chances are that there may have been irreversible brain damage caused. As long as your son's father is in an induced coma, it's hard to tell whether there is any irreversible brain damage or not. A CT or an MRI of the brain might answer this question. Furthermore, Karen, the cooling therapy that you are referring to is also a therapy that most intensive care units are nowadays using in order to protect the brain and other vital organs after a possible insult through lack of oxygen for a prolonged period to the brain or to other vital organs. Generally speaking, what's happening is that after cooling therapy and the induced coma, it might take a day or two until your son's father might wake up. Normally, during the cooling therapy that can last for up to 72 hours, the drugs used to keep your son's father in the induced coma are quite potent, and therefore you can expect a delay in waking up even after the sedative drugs have been ceased. Furthermore, if a hypoxic brain injury has been sustained, you can expect further delays if your son's husband hasn't woken up after 2 or 3 days after the medications for the induced coma have been ceased, and there is a fairly high chance that there may have been a hypoxic brain injury. Having said all of that, sometimes critically ill patients in intensive care just take their time to wake up, no matter how quickly people around them want them to wake up. A critical illness such as a heart attack and a cardiac arrest is a massive event, and therefore your son's father might just need more rest and recovery at this stage, and time will tell. Further testing like the CT of the brain that I mentioned before should be done if he's not waking up. If your son's father has sustained irreversible brain damage, it should show up in the CT of the brain, and if it doesn't, they should be doing an MRI of the brain to get further clarification. Even if your son's father doesn't have brain damage, once he gets out of the induced coma, he may still not wake up as you expected, because he might still be under the influence of the drugs from the induced coma. He might be confused and agitated, but he might also be perfectly fine. Be patient. Nothing happens quickly in intensive care. Once your son's father is coming out of the induced coma and is waking up, he should be able to be weaned off the ventilator, because he should start breathing by himself, even if he does have brain damage. As far as your power of attorney or next of kin situation goes, Karen, most hospitals have the right to withhold information if you are not the power of attorney or next of kin. In order to get fully informed, you might have to ask your son's father, power of attorney or next of kin, to give you the information that you want. However, they don't have to do that if they don't want to. I hope that helps. Please let me know if you have any other questions. Take care. So, how can you become the best advocate for your critically ill loved one, make informed decisions and get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. how to stop being intimidated by the intensive care team, and how you will be seen as equals. You'll get crucial behind the scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's episode of Your Questions Answered, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me. Find phone numbers on our contacts tab. Also check out our ebook section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype or over the phone, or via email by clicking on the email and phone counseling tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.